those things are.
Exactly. It depends what you're at. You get rejected work instead of having cocktail.
Lavish ones. You know, some of the solutions
Considered to be the or, even though, you know, hopefully set up a neighbor killed so easily.
That's very important. The subject of depression has gotten a lot of media attention lately, from the revelations that former President Abraham Lincoln suffered from it to the idea that it's fueled the growth of teen suicides. It's become the most common mental health problem in the U.S., diagnosed in 17 million Americans, 1 in 33 of them children, 1 in 8 of them teenagers. Joining us to shed some light on that problem is Dr. Hatice Yilmaz. Thanks for joining us today.
Thank you so much for having me.
This has become huge, and it's kind of been undercurrent for a long time.
Unfortunately.
But in your practice, what are you seeing now?
It's getting really more common.
Among teenagers or smaller children? Or?
Usually among teenagers, but we also see little kids also. And like 11% of American teenagers suffer from depression before age of 18.
Wow.
And unfortunately, 3.3 of them have severe depression.
Now, when you see these children, and when you talk about severe depression, what is how does that manifest itself?
You know, depression manifests different in children compared to adults. Kids, they usually feel irritable, anger. You know, when adults get depression, they usually isolate themselves. They don't interact with people. But when kids get depression, they get so irritable, angry. They may have behavioral problems at school, and they show poor performance, academic performance. Sometimes they complain about severe, like physical pain, such as belly pain or headaches, which do not respond to the treatment, and they have severe concentration problems. And in most severe cases, unfortunately, we see kids who have thoughts of or like actions of hurting themselves.
They'll lash out.
Yes.
What do parents look for at the onset of this? Are there things that you know that will show?
Yeah, these are the things that the parents should keep an eye on, that the change of the behaviors of their children. And the most important thing is they should really get involved in the school, their social activities. They should monitor their children really closely. And if they feel like, if they see those symptoms like more than 2 or 3 weeks, and then they should seek for professional help.
Some help. How much of the schools are involved in this? I mean, should parents be in touch with the counselors at school to say, hey, keep an eye on my youngster? Or?
Yeah, and they are really, the schools are helping a lot, and they have counselors, and the classroom teachers, they have some background, and also, you know, sometimes they seek professional help. And sometimes we get direct referrals from the schools. The teachers get concerned. The parents sometimes don't see the changes, and then
so
they get
call
referrals.
Yeah. Is this the same among girls and boys, or does it present more among one or two than the other?
Boys are less likely to have depression compared to girls.
Is that because girls perhaps are under more pressure?
And also maybe girls, I think they can express themselves better than boys. If they have depression, they can, you know, ask for help. But boys usually
they want to be
a tough guy. Yeah.
Okay. Okay. Treatments. We talked about counseling, but does it go beyond that, or does it go to medication, that kind of thing?
Yeah, absolutely. You know, usually in mild cases, we recommend individual and family therapy. Family is a really key component in the treatment, and we ask lots of like parents' involvement, and we do sessions with parents, including the kids. But sometimes if counseling, the therapy may not be enough, in the severe cases we recommend medication. We have many different options for the medication management.
Well, so there is treatment available.
Absolutely, yeah. It's a treatable disorder. The most important thing is the parents should be aware of that. This is a real psychiatric problem, and kids can suffer.
And they have to really be observant.
Absolutely.
Thanks, doctor, for coming on board. Very insightful.
Thank you so much for having me.